India has decided to suspend the use of rapid testing kits for COVID-19 after complaints that many were faulty. India imported nearly 1 million of the antibody test kits from China. They're meant to be faster and cheaper than the standard swab test. But there have been complaints that the kits fail to detect the virus, even in confirmed COVID-19 patients. The US and the UK have reported similar issues with kits from China. Cases in India have almost doubled over the past week to nearly 20,000. For more, we're joined by Neha Punya in New Delhi. Neha, how will the suspension affect India's ability to test for COVID-19 just when cases seem to be surging?
Steve, it is a concern, especially when you look at the rate at which the number of COVID-19 cases have increased. We've gone from 10,000 to nearly 20,000 cases in just a span of over 1 week. But the government is playing this down. They're saying that they're not too concerned because these rapid testing kits weren't being used for diagnosing COVID-19 patients, simply for surveillance purposes. But it is a concern because these kits are a lot cheaper than your regular nose and throat swab kits are, and the results come out much faster in about 15 minutes compared to 6 hours that the regular kits take. So it will set India's ability to test people back quite a bit. But the government maintains that the lockdown has tremendously helped slow the spread of COVID-19. They're saying the rate of cases doubling was 3.4 days before the lockdown came into effect in the last week of March. It's now at about 7.5 days, and they say that the curve has flattened quite significantly, and that another week and a half of the lockdown that's left will also help slow the spread of the virus. But they're also saying they're not going to let their guard down. They're expecting a second wave of infections in late May, early June, and it's quite possible, the government says, the lockdown will be extended beyond the 3rd of May.
Neha, also a disturbing development. The government, we hear, is moving to protect healthcare workers from abuse.
That's right. A short while back, you had the government announcing that it is announcing amendments in an existing Epidemics Act that's about 100 years old, essentially to make any attack against doctors or healthcare professionals a non-bailable offence. If anybody is found attacking doctors or healthcare workers, they could face a jail term of up to 7 years. They will also be liable to pay a fine anywhere between $1,300 to $6,500. And the reason the government took this step was because many doctors and nurses were planning to hold a nationwide token protest on April 23rd. After the government announced these amendments, that protest has now been called off, and we can imagine what that would have done, that protest coming at a time like this where there are over nearly 20,000 COVID-19 cases in India. The government has also said that attacks against healthcare professionals is completely non-negotiable. We've seen several heartbreaking instances coming to light from different parts of the country. A few weeks ago, a viral video clip showed a doctor being assaulted by her neighbor because she was working at a government hospital where there were many COVID-19 cases. One doctor was sleeping in his car for many days to avoid any kind of stigma associated with treating COVID-19 patients. And just earlier this week, a doctor was denied burial by a mob who claimed that if he was buried in that cemetery, that he could possibly infect other people who were coming there to bury their loved ones as well. So significant stigma being faced by doctors, but the government says that this new amendment should possibly put all of this to rest.
Some big challenges for India to overcome there. Neha, thank you very much for that update. Neha Punya there in New Delhi.